and we go into the rooms together as a big team. And so I tend to sit back and I get talking, and then I eventually cross my legs, and as I cross my legs, my pant leg rides up and the socks are out, and then the kids will always point and say, "See, Mom, look what he's got on today, and I knew they would be those ones, or I knew it would be that color." And so what's happened is it's not uncommon for the little boys when they get to be 5 or 6 or 7 years old that they'll start to, when they come to clinic, they want to dress up. You know, I'm not sure there was ever a conscious decision to start going with crazy socks, but I like to dress up. On days when I don't have to operate, then, you know, I like to, you know, pay attention to what I wear. And so I always am joking with my kids at home about you have to pick a minor color on your tie, and then you have to coordinate that with your socks. And so eventually, when you have enough suits and enough ties, you have to get enough socks to sort of to work the outfit. You know, it's not even just the little kids, because interestingly enough, there's plenty of times I'll be making rounds on the adults and seeing inpatients. And I can remember one patient, you know, very specifically who, you know, we walked in and we were talking about, you know, some fairly serious liver transplant stuff. And then at the end I got the, "Hey, by the way, where'd you get those socks? You know, I think I have socks like those." And so then that became a thing for us. So then he got his socks and I had my socks, and each day we would kind of choose a different kind of sock combination and see whose socks were cooler at any given time. So all of the pairs that come from people are, you know, memorable because they come from a specific person. And so you know, they all have specific attachments. They'll be out and they'll see, you know, a funny pair of socks that's got something that might remind me of them. So I have a few pairs of socks from one patient specifically who, there's little things that they brought me that they say, "Well, this made us think of you, and so now you'll think of us when you wear these socks." And so I have different pairs like that over the years. And
nothing bad's gonna happen.
We're with them so much, and we spend so much time with them that I guess, you know, it's not a contrived thing to try to, you know, create something to talk about. It's just, we're pretty close, we're pretty tight, we spend a lot of time together. And so I'm fortunate because I love being a surgeon, but I mostly just like looking after people. If what you care about is the caring part of things, then everything else is just kind of fun, because you know every day is going to be an okay day. You're always going to be looking after patients, and that's always going to be a rewarding and fun experience.